Welcome to the Codecast podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the 87th episode of the Codecast podcast. My name is Terry Fletcher. I'm happy to have you here today with me. Today is the last Tuesday of June, so that means we are at Top 10 Tuesday, and I appreciate you being here. This is when we do either a top 10 list of the coding questions I got during the month, or it's a top 10 list that I find something that has come up for me during the month that I feel that it's important to go over with you. So there's going to be some variations on some things. One of the things that I've noticed lately is I'm getting a flood of emails from people that are asking coding questions or for advice. I'm getting a lot of emails on career advice and things like that. But I wanted to bring something to your attention, especially I want to shout out to the administrators, the billing managers, the office managers, anybody who's a boss out there. And I want to show you how to email back like a boss, because I think part of this has to do with a little bit of professionalism, but also you need to show that you have confidence in what you're doing. And sometimes I feel that there's a lack of confidence sometimes when you're in charge on what you're actually doing. I've been talking to a few people that they give themselves the title, or they have the title of manager or director or administrator or something to that effect. And then I read their email or I see their approach to attacking a problem, and I'm concerned because I want you to have that credibility, to have that polish, and to make sure that when you bring something to the attention of your physician or your superior, that you have that email like a boss. Okay, so that's the mentality I want you to have, and I'm going to help you with that today in the field of healthcare. But first, the Codecast podcast is also brought to you by Movado Watch Company, Hugo Boss, MVMT, MovadoWatch.com. So even though I am going to talk about emailing like a boss, and you'll understand what I mean about that, I am also going to have a coding question, one that actually came into me today. And then also I want to talk to you about an article that just recently was published in actually a topic that I've been struggling with, and it's AI, artificial intelligence, when it comes to healthcare. And the topic for me is very similar to computer-assisted coding. I think there's so much reliance right now on EMRs, EHRs, and things that are inputted by a human for computer assist or digital assist or artificial assist, as we've seen in some of the surgeries now, that it seems like everybody is afraid of the artificial intelligence taking over. And I am too. I think that you have to, at some point, realize that there's certain things that algorithms and programming, and no matter what you do from a digital standpoint, it's not going to be the same as human input. And this article that came out actually is kind of scary. So I just want to let you know there's going to be about a 3-minute segment that's going to sound like a true crime segment. And so I'll let you know when it's coming, because when you hear what I'm going to kind of summarize for you, you're going to be like, oh my gosh. And it's a little bit scary. So when I read it, I had to read this article 3 times and take a breath, because some of the information was just like, oh my gosh, why isn't anybody talking about this? So we'll get to that. But first, in our Top 10 Tuesday segment, let me tell you the top 10 tips on what I would give you to email like a boss. So first of all, let's say that you were given a project and it took you a little while, but in your mind you're thinking, okay, yes, I took a while, but you can deal. Well, obviously that's not professional. So instead of sending that over and saying sorry for the delay, I would say something in a very professional manner, saying thank you for your patience. Here is the report you requested. So there's a difference when you're trying to basically, I don't want to say make an excuse, but at least you're saying, okay, yes, I took a while, but I appreciate your patience, instead of apologizing. You don't always have to apologize. There will be one apology here, but this isn't it. So go to thank you for your patience. Another one is my schedule matters too. And how many times do you feel like, okay, I'm working here and nobody really respects your schedule? And so what you basically sent over on an email is you send something that says, okay, what works best for you, as you're eye rolling. But But your schedule matters too. And I need to take my advice on this. So what I do, because I have a lot of clients that I absolutely love. I love my clients, love helping them out, love scheduling. We have these phone meetings and these conference calls and things like that when I can't be there in person. But a lot of times, and I'm sure this has happened to you, where you'll schedule something, you will make it a point of being there, clearing your desk and clearing your time schedule for that hour or that 2 hours. And then all of a sudden they say, well, the doctor has to be in the cath lab, or the doctors can't make it because they weren't given the time to dial in. And I'm thinking, of course they were. How many times were they? But here's what you do. You basically say, can you do, and give them a time. Can you do 6:26 at 10 o'clock, or can you do 7 o'clock in the morning, or can you do 6 at night? And be flexible, but give them 3 choices and let them pick a choice. Don't say what works for you, because trust me, I've done that before. And somebody said, can you do midnight at this time? It's like, no. So your schedule matters too, and be flexible. Try to do a very early morning, also one that's around closing time, because there's a lot of times he will be available. And it's really tough sometimes during lunch hour, because let's face it, depending on what time people start, they could have a lunch hour that starts at 10:30 or one that starts at 2:30. So lunch hours are very tough. But again, try to reflect that your schedule matters too, and they should have respect for that. So let's say that you have a scenario where you provided somebody with information that they didn't ask for, but that you knew that they wanted, and they don't thank you. And you're like, okay, yeah, you're welcome. Can you say it that snarkily? No, you can't. And so you don't want to email too, no problem, no worries, guess what you got for me. What I would do is I'd follow it up and say, always happy to help, anything you need. So try to not be too snarky about that. The other one is, I know that sometimes you are questioned for something and you know what you're doing, but you aren't confident in conveying that. And so you'll send something over on an email that says, I think maybe we should. First of all, I think means you don't know, and maybe means you still don't know and you really don't know. What would be better is to say, it'd be best if we did this. So give your opinion, be confident in your opinion, and that will give you some credibility as well. Number 5 is wording. This is hard. So how do you do that? Well, don't rewrite your email for 40 minutes because basically at some point you're either going to send it to the wrong person, or it's going to say something that once you hit send and you hear that swish go, you're going to be, oh, no, I didn't want to send that. That's happened to me before. But what I would do is I would say, it would be easier to discuss this in person, and give them a time that they can call you or meet you at your office. And so there's a lot of things. Remember, we don't know tone in email. We don't know tone in a text. We don't know tone in a chat you send somebody. And so you could say something that you're kidding and they think you're serious, and that can be a problem. Number 6, do you get it? Yeah, we don't want to say that. A lot of people will say, well, hopefully that makes sense to you. Well, you just basically called them an idiot or said that they didn't understand what was going on. Yeah, let's not do that either. So what you want to say is, when you send your information, just let me know if you have any questions, if there's any concerns. And that way they can give you feedback, and you're basically in a not so subtle way asking for them to respond. And then the other thing is, where the heck are we on this? This is one that I send out every once in a while, because with the people that I work with and colleagues are typically subcontractors. And when I send you an email, I expect you to respond to it. And sometimes what happens is that then I cross it off my list as I've taken care of it. That person doesn't respond to it. And now all of a sudden 3 or 4 days later, or a week passes, and I'm like, oh shoot, did that get done? And so that's something that I need right away. So instead of saying, I just want to check in, that gives the person a reason or an opportunity to give you an excuse. You want to be direct. When can I expect an update? And that would be the email that you would send. How about, I made a small error? Okay, so instead of saying, oh, sorry, my bad, totally missed that. I get those every once in a while from people. What you want to say is, let's say that they caught your error. Own up to it. Say, nice catch. Updated the file attached. Thanks for letting me know. Actually, one of my podcast listeners and we're going over some information on prolonged services. Shout out to Pam in Florida. And one of the things that I had on prolonged services was that you can have total time on a given date. And you can have that in the hospital, but in the office setting, Medicare manual kind of hides this in a little section of their manual, saying that on prolonged services, they want from and to, and that's actually a Medicare rule in her state. So I appreciate her bringing that to my attention. And I said, nice catch. So you always want to know that as much information you think you might store in your brain, and you may have a really good knowledge about something, there's nobody out there that knows everything. So always be open to someone else giving you some information that you may need. And that just keeps you a little bit humble there as well. And then what about I have an appointment? So for those of you that are not managers and you're approaching your manager, here's what you want to say. If you have an appointment, you have something you absolutely need to be at, instead of cowering and saying, could I possibly leave early? That just lets your manager or lets your supervisor say no. I would like you to get in the habit of saying, I will need to leave for blank at blank. Let them know what it is. It's not like you're taking a vacation day and you have to tell them and you don't have to tell them what you're doing. But if you're at work and you need to leave early for an unexpected or a problem that popped up, it is important that you communicate with your supervisor or your superiors and let them know, I need to leave at this time. And basically that's what you have to do. Nowadays, people do understand that. They understand if you need to leave it's the first time my daughter's going to be playing this game, and especially if you're not somebody who's habitually leaving early from work, or I have this doctor appointment, it took me 2 weeks to get it, and you're working a medical clinic, so you know how hard it is to get in sometimes. But a lot of times your supervisors will be flexible if you basically just give them time, date, and why. So it just can be really helpful if you're just direct about it. Let me just give you a little tip on something about being truthful, especially today in the era of social media and phones and how people can find out what you're doing. A couple of practices recently that I help manage basically said, yeah, we have staff here that are saying, oh, I need to do this or I need to do that, making it sound like it's a medical emergency or something with their child or something that really matters that they need to take care of. And then we find that they've posted on their Instagram or their Facebook page that they're out having drinks and partying with their friends. One of the things about that, it's not so much what you're doing, it's the fact that you lied. So make sure that you're telling the truth, that you are somebody that can be trusted, and that try to keep the things that are probably not appropriate for a boss to see off of social media. I know a lot of people say, well, I can do what I want in my private time. Then make your account private. But everybody's looking. We now tell our kids, hey, if you want to go to a certain college, get off social media. Right now, I mentioned on a different podcast, and I appreciate everybody congratulating my daughter on finishing her teaching credential. But she's somebody that likes to go out with her friends. I'm not saying she goes out and parties like that, but she does like to do things that maybe certain places may think it's something that maybe a conservative teacher doesn't do. And, I said, hey, I appreciate that you look great in your bikini, but can we just put it on private right now? And she's like, okay, fine. I'm like, you're 24 years old and you want to teach high school. Let's take it down a notch. I know that's mother talking, but you get it as far as an employer and what they're looking at. And so it's important that you really try to hold yourself to a higher standard, especially in the medical field. It just then gives you credibility with your job. Whether it's anybody's business or not, it just helps you out. So that's number 9. Number 10 is something that I actually had to do yesterday, and this is to Rhonda in one of my ASC clinics, and they're a Coding Corner client. And so we were having an exchange back and forth. I was helping with an appeal letter, and she had sent me an inadvertent op report or something that didn't apply to what we were talking about. And it was a pretty easy mistake. But I had gotten from a different client a bunch of wrong information yesterday, and I think my frustration level just came to a head. So unfortunately, I did take it out on her, and I said, "What are you sending me? Don't waste my time." And I was not appropriate in my response back, and so I came into work the next day, said, "You know what? I apologize. I was a little bit harsh with you and it was not fair to you. So I do apologize. Please send me what I need on this op report." She did. And also her response back was awesome. It was, "Thank you for that." So it was just something that you always have to be professional, which I am, but there are times, and all of us have had them, where we have a frustrating day and we need to pull back the reins. We're all human. We all have issues when it comes to some certain frustrations, but at times own it. If you say something to somebody and you take take that 24 hours to think about it, and you know that that was probably not an appropriate tone, own it and apologize for it. It goes a long way, not just with your credibility, but with your professionalism, and they can see that you definitely know what you're doing. So my coding question today is from Michelle in Arizona, a cardiology practice client of mine. So she sent me something which was an op report, and she said, Terry, I've never seen this before. Can you take a look and tell me what this is? Well, what had happened in the report was that they were trying to access a patient through the common femoral artery, and they were trying to manipulate a catheter through the patient's lower extremity, but because of the tortuosity and basically the vessel was just occluded and it was just too tortuous. Basically, they were having a really hard time manipulating the catheter and it broke. And so they had to go back in and try to retrieve the catheter percutaneously and remove that foreign body. And they were able to do it. And so it was successful. And they did it under fluoroscopic guidance. And the code for that was 37197. And that was for the broken catheter tip. So she didn't know what the code was. But we appreciate her asking that question because that does happen on occasion. Our coding quarter question is brought to you today by Simple Health Radio, simplehealthradio.com. Check out Dr. Emron's podcast each week. His tagline is, want to be smarter in 10 minutes? Listen into my podcast. Okay, so for this one thing I wanted to bring to your attention, it was from an AI in medicine, precision medicine conference in Boston this past week. And there were some different speakers that talked about, can artificial intelligence accelerate precision medicine? And these were all Harvard School of Medicine physicians and professors that were talking about these different questions. And one thing that was posed by a Harvard Law professor, Jonathan Zittrain, he said during the conference, he said that there was some issues that were examined using the AI to accelerate the delivery of precision medicine to the masses. And he gave kind of an alarming metaphor, and it mesmerized me. I went and listened to everything that was going on at the conference. It was actually available live, so you can listen to it in real time. And what this professor said is he said that he feels that AI is particularly problematic because of how easily it can be duped into reaching a false conclusion. So he gave an example up on the big PowerPoint screen, and he said, he goes, okay, so this is an image of a cat that a Google algorithm had correctly recognized as a tabby cat. On the next slide, it was nearly the identical picture of the cat with only a few pixels changed, and Google was 100% positive that the image on the screen was guacamole. I kid you not. And you could see it. It was clearly a cat, just a little bit different, again, algorithm or pixels. So it just had a basic difference in look to it. And he said, this is a frontline system. This is installed across the world for image recognition, and it can be tricked that easily. He goes, so now let's put this in the world of medicine. How do you feel when the algorithm spits out with 100% confidence that guacamole is what you need to cure what ails you? And of course, everybody laughed, but he was part of a panel that explored the pitfalls of applying AI in medicine, and that many ethical, political, and scientific questions that must be addressed to ensure its safety and effectiveness aren't being addressed right now. And so as we move forward into not only artificial intelligence, but also what we are talking about in high technology, we have to be careful with certain algorithms because, okay, think about how many people wear, let's say, wearables for irregular heartbeats and rhythms, or tremors that can indicate the onset of Parkinson's disease. But wearable data, they're not the same as numbers on a spreadsheet. They can't be easily anonymized, if you will. So basically, it's how many people think you could de-identify your genome. Probably not, because your genome is unique to you. It's almost like your DNA. It's the same with most of the biospecimens coming off a lot of wearable and sensors. And so here's the thing there. This poses a privacy dilemma that's playing out on a daily basis as health tech companies are trying to compile more data to talk their customers into artificial intelligence. And so there needs to be some meaningful regulations that need to be developed surrounding the collection of this data for healthcare. And so if algorithms are really considered the new drugs, if you will, shouldn't they be regulated with the same rigor? So if you think about digital therapeutics, they all have a certain mechanism of action. Is there an argument? There is an argument that we've learned in healthcare to look at digital treatments in a way that we also looked at drugs. And so right now I'm seeing that this is going to be an entrepreneurial question. Somebody's going to jump on this bandwagon before there's an issue that happens within the healthcare field that's going to be detrimental to the patient and experimental instead of positive. So one of the things that's been really tough when it comes to some of this information is that AI is often discussed as a tool for eliminating bias in healthcare by helping doctors to standardize the way they care for patients. So if a computer could provide objective advice on the best treatment for a patient, then they're saying variations in care would diminish and everyone would get the most cost-effective care. But here's the problem. AI is just as likely to perpetuate bias as it is to eliminate it. And they talked about this and the Data and Society Research Institute in New York that was at the same conference. They said because bias is embedded in the data being fed to the algorithms, so the outputs could be skewed as the result. So there was an article recently in the Atlantic magazine, and it said it highlighted an algorithm that used to identify skin cancer that was less effective in people with darker skin because the pigmentation was different in the algorithm. In mental health care, data kept in electronic medical records has been shown to be infused with bias towards women and people of color. The inequity in the data doesn't just translate to unequal treatment, but it can also lead to ineffective care. And now you're looking at, fairness in the application of precise medicine. So using AI has the potential to advance medical insights through the collection and analysis of large volumes of types of health data is taking people's focus off of the potential danger of some of these technologies and unfair outcomes. So, AI is excellent in finding correlations within data that are difficult for humans to detect, a skill that can be used to hone in on the causes of a disease and to help develop a more effective medicine. However, correlations are also surfacing with AI. Noted one correlation that, again, we won't go back to this Harvard Law professor. He said there was a correlation. Now remember, we're talking about correlations, not causes. So in one of the AI algorithms, there was a correlation between the number of suicides by hanging or strangulation in North Carolina and the number of lawyers in that state. Okay. And then there was another example in the shape of a graph of opium production by year in Afghanistan correlated with almost exactly, by the way, with the silhouette of Mount Everest. So the point, he said, is that the correlation is just that. It's a correlation. It's not a cause. And AI is not so great at distinguishing between the two. This could mean that if you are given advice that you take certain medicines or change your diet in order to remedy a medical problem based on associations or correlations that in fact have nothing to do with causing the medical problem in question, then this could actually hurt a patient. So what actually was more of the commentary of this conference was that they're really hoping that academic departments in healthcare use these associations to set agendas for their research. So you can't just run different machine learning models and spits out one thing. Remember, all patients aren't the same. And so this is where, I know that wasn't quite the true crime I promised you podcast, but just so you know, you have to be careful. I've seen some of these AI procedures. One was looking at retinal repairs where they used a grape and basically a machine, a robotic surgery to replace the lens. And you should see how they lift the little layers and different layers of the skin of the grape. And that was kind of frightening to me. What if they get stuck? One of the things that I do a lot is I travel, I fly and things like that. And as I get older, it's a little scarier for me. All of a sudden I'll hear a certain noise or I'll hear something. I'm thinking, okay, did the plane stall? What's going on? And it's very scary. And I think about that sometimes when I think about all of this artificial intelligence. So the reason I just bring it to your attention is that sometimes you don't get a chance to read up on some of these things. And I just want to make sure that you are in the know of what's being discussed just as recently as last week, and making sure that you have some information that maybe you didn't have a chance to research. So we had a positive email this week that I thought was great. I get a lot of positive emails as far as the podcast. And before I forget, I want to shout out to Shelly from Missouri, Tammy Sue from Colorado, and also David, who contacted me today, who is a revenue cycle manager and also does HCC coding. Thank you all for such really kind words on the podcast. And I appreciate it when you also congratulate my daughter. Thank you very much. That was very sweet. You were also saying stuff towards my personal comments, so I appreciate that. But the one email I got this week, which I thought was so cool. So we've been named one of the top 50 podcasts for insurance adjusters. Okay, so for those of you on the call, you have to find that ironically funny like I did. My podcast was geared towards you, staff members, administrators, billing managers, coders, billers, anybody who touches any kind of report or is trying to learn more about healthcare from a coding perspective. That's why we call it the Codecast, or billing or revenue cycle management or collection and appeals. But what I found cool was that on a list of 50, we were number 6. And so I know that a lot of times the doctors will say, oh, the insurance companies are my enemy, or, they're out to get me. And I look at them as, maybe not quite our friends, but they're definitely in a reciprocal relationship with us. Remember, insurance companies, just like us, they wouldn't have a job if they didn't have us, and we wouldn't have a job if we didn't have them. So if everything was a cash pay, the doctors don't need us, they just need a cash register. So if the insurance companies didn't have claims to pay or issues to deal with, then they definitely wouldn't have a job either. So I try not to look at it as an adversarial system. I look at it more as a reciprocal relationship that we're trying to cultivate. So it sounds like they picked up on that, and we appreciate that. So to any of the insurance companies or payers that are out there listening, thank you. We really appreciate you listening to the Codecast podcast. So we hope that you pass it along. That was a great surprise this week. So everyone, we're heading now into July. Can you believe it? And so we'll have some new information coming out next month. A couple of topics I just want to let you know I'm going to cover. And the next one is going to talk about how to document time in your E&M record. Everybody keeps asking me. And then critical care, that's going to be the week after, I think. And then somebody had asked for some information on transgender coding. So I focus a little bit on the ICD-10 more than I do procedurally, but I'll throw in a couple of questions on that because that has come up recently. And then I also want to speak to some of the dermatology and skin folks out there, the integumentary system. I know you're having some struggles out there with removing lesions and trying to make sure that you get all the margins covered and all of that. So if you are a specialty that I haven't talked to you about or haven't covered, and I've covered a lot, please just send me a quick DM or an email or a message on Twitter or on my Instagram account, any social media platform. Visit me on Facebook. I have one there that says Terry Fletcher Consulting, so take a look at that as well. And we're happy to see if we can put something up for you. So a lot of information coming up soon and different specialties, and hopefully you'll continue to listen. We're over 60,000 listens at this point, which is exciting for me. So we are growing by leaps and bounds. So everyone, go out and make it a great day and a great week. And thank you again for listening to the Codecast podcast.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter at TerryCoder1 or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.